researchers continue working toward a vaccine and therapies to treat COVID patients. But doctors warn convalescent plasma is not the breakthrough some believe it to be in the fight against COVID-19. The idea is to infuse antibodies of someone who has recovered from the virus into a person who is actively fighting it. Emory Dr. Carlos Del Rio says the treatment isn't likely to hurt you, but it may not help you much either. A study by the Mayo Clinic found people who received the plasma within 3 days of their first symptom had a slightly higher recovery rate than those who received it later. But he points out the study did not compare recovery rates with those who never received plasma as part of their treatment.
I'm not convinced this is a breakthrough therapy. I'm not convinced this is the solution to our problems. I just think this is an incremental advance in the therapy of COVID-19 that deserves further study.
Dr. Del Rio says you need blood rich in antibodies to even stand a chance at being effective, and not all plasma is the same. Today, the Department of Public Health reported about 2,300 new cases, as we were saying. That definitely has our curve heading in the right direction. Hospitalization also has stabilized with 56 new patients admitted for care. Dr. Del Rio says it's a sign masks and social distancing together are working. He stressed the importance of continuing both and getting the flu shot. That way, he says, you're less likely to get sick from either.